Dr. Mark Hyman, a leading voice in functional medicine, once said, "Medicine today is too focused on diagnosing problems, not preventing them." And in seniors, too much testing often leads to unnecessary treatments and real harm. This statement may sound surprising. After all, aren't routine tests meant to keep us safe and healthy? But here's the truth. Once you turn 60, the way your body responds to certain medical tests, and the treatments that follow, can change dramatically. While regular health checkups remain important, not every test is safe, necessary, or beneficial for older adults. In fact, some of the most commonly recommended tests can lead to false alarms, risky procedures, and treatments that do more harm than good, especially when they are done too frequently or without clear symptoms. For example, did you know that some seniors are still getting full body scans every year, just in case, even though studies show they increase exposure to radiation without offering any added protection? Or that thousands of older adults are being put on lifelong medications just because of slight test variations that are completely normal for aging bodies? In this video, we're diving deep into 6 medical tests that many people over 60 continue to do, but that may be silently hurting their health instead of helping it. We'll explore what these tests are, why they can be dangerous, and most importantly, how to make better, smarter choices for your health. So please, watch this video till the very end. Because the next test your doctor recommends might not be as helpful as you think, and knowing the truth could protect you from unnecessary stress, side effects, and even surgery. Don't forget to like this video, subscribe, and share it with someone you care about who's over 60. Let's spread awareness and protect our senior community from the hidden risks of overtesting. Test number 1. Routine PSA test for prostate cancer. Let's begin with one of the most controversial tests for older men, the PSA test for prostate cancer. The prostate-specific antigen, or PSA test, measures the level of a protein in the blood that can be a sign of prostate cancer. While it sounds straightforward, the truth is far more complex, especially for men over 60. According to the U.S. Preventive Services Task Force, routine PSA screening in men over 70 is not recommended. Why? Because studies show that while the PSA test can detect early prostate cancer, it often finds slow-growing tumors that may never cause symptoms or harm during a man's lifetime. Yet once detected, these low-risk cancers often lead to invasive biopsies, radiation, or surgery, all of which come with serious side effects like incontinence, erectile dysfunction, and infections. Imagine going through a stressful cancer diagnosis, surgery, and recovery, only to find out later that the tumor might have never posed a threat in the first place. That's the real danger of overdiagnosis. Even worse, PSA levels can rise due to non-cancerous reasons like infections, prostate enlargement, or even cycling, leading to false positives and unnecessary panic. This doesn't mean PSA tests are useless. Far from it. In men between 55 and 69 who are at high risk, for example, with a family history or African American descent, the benefits may outweigh the risks. But blanket testing for everyone over 60? That can be more harmful than helpful. So what should you do? If your doctor suggests a PSA test, ask, what would I do with the results? What are the risks of a false positive? Do I have any symptoms or high-risk factors? Shared decision-making is key. Don't say yes to every test just because it's offered. Make sure it makes sense for you. Test number 2. Annual full body scans. Next on the list, annual full body scans. These are becoming increasingly popular, often marketed as a total health checkup, or a way to catch cancer early. Sounds great, right? But for seniors, this test is not only unnecessary, it may be downright dangerous. Full body scans often involve CT scans or MRIs, exposing your body to high levels of radiation, sometimes equivalent to hundreds of chest X-rays. According to the FDA and the American College of Radiology, there is no scientific evidence that annual full body scans reduce mortality or improve long-term health outcomes. What they do increase is the risk of finding incidentalomas, harmless abnormalities that show up on the scan but have no clinical relevance. These incidental findings often lead to more tests, biopsies, or even surgeries, creating a cycle of anxiety and intervention that can be far worse than the original issue. And let's not forget the cost. These scans are expensive, rarely covered by insurance, and may lead to over-medicalization, where we start treating things that don't need to be treated. For people with no symptoms, no family history, and no specific risk factors, full body scans are not only unnecessary, they may actually cause harm by leading you down a path of unneeded treatments. So what's the smarter approach? Instead of a full body scan, focus on age-appropriate screening based on your personal risk factors. Blood tests, ultrasounds, or targeted imaging only when medically justified. And above all, listening to your body and communicating openly with your doctor. Remember, more testing doesn't always mean better health. In fact, sometimes it leads you away from it. Test number 3, frequent bone density scans, DEXA, in low-risk seniors. Bone health is undoubtedly important as we age, but many seniors are being subjected to bone density scans far more often than necessary, sometimes every year, even when their risk hasn't changed. This test, commonly known as a DEXA scan, measures the density of your bones to assess the risk of osteoporosis and fractures. But here's the problem. For low-risk seniors, repeating this scan too frequently leads to overdiagnosis and the unnecessary use of medications that may cause more harm than good. Studies have shown that bone density tends to decline slowly over time, and in most healthy older adults, especially those who are active, eat well, and have no history of fractures, repeating a DEXA scan more often than every 2 to 5 years offers little to no benefit. Yet, despite this, many seniors are prescribed powerful osteoporosis drugs like bisphosphonates, such as Fosamax or Boniva, after just a slight dip in bone density. These medications come with side effects including jaw osteonecrosis, severe joint pain, and even rare fractures in the thigh bone. Additionally, minor fluctuations in scan results are sometimes just normal variations, not a sign that your bones are crumbling. Sadly, these subtle changes often prompt unnecessary worry or medication. For low-risk seniors, this can mean years of taking drugs that their body never needed in the first place. Instead of relying solely on scans, seniors should be evaluated based on a full picture of their fracture risk, including age, family history, activity level, calcium and vitamin D intake, and any history of falls. A single DEXA scan at age 65 or 70 may be enough for many. If your doctor recommends another bone density test, especially if your last one showed only mild osteopenia and no recent injuries or changes, ask, has my risk changed since the last scan? What would you do differently based on the results? Let's focus less on numbers and more on real-life prevention, like strength training, balance exercises, and proper nutrition. Test number 4. Too frequent colonoscopies. Colonoscopies save lives. No doubt about that. They can catch colon cancer early and even prevent it by removing polyps before they turn dangerous. But just like with many medical procedures, more isn't always better, especially after a certain age. The American Cancer Society and U.S. Preventive Services Task Force recommend stopping routine colonoscopies after the age of 75, unless you're at high risk or have had abnormal results in the past. Why? Because beyond this age, the potential risks of the procedure often outweigh the benefits. Colonoscopies aren't risk-free. For seniors, the chances of complications, like bowel perforation, internal bleeding, and adverse reactions to anesthesia, increase with age. If your last colonoscopy showed no polyps or signs of cancer, and it's been less than 10 years, repeating it may offer little value and greater risk. Despite this, many older adults continue getting screened well into their 80s, often because it's on autopilot in the healthcare system. Doctors may recommend it out of routine, not because there's a specific reason to be concerned. But in healthy seniors with no symptoms, non-invasive options like the FIT test or stool DNA test, such as Cologuard, can often be safer and just as effective in detecting potential problems. The other concern is what happens after a colonoscopy. If a small, harmless polyp is found, it can lead to follow-up procedures, repeat tests, and even surgery, again, increasing the risks of complications and the emotional toll on older adults. It's crucial to remember that colonoscopies are screening tools, not lifelong rituals. If you've had a clean test in the last decade and you're over 75, you may not need another one at all. And if your doctor recommends one, ask, what's the goal of this test at my age? Are there safer alternatives I can consider first? Ultimately, the goal should always be quality of life. Screening makes sense when it leads to interventions that help you live better and longer. But when a test adds more risk than benefit, especially in your later years, it's okay to say no. Test number 5. Cardiac stress tests without symptoms. If you're over 60 and have ever gone to the doctor for a checkup, there's a good chance someone recommended a cardiac stress test, even if you had no symptoms of heart disease. These tests are often ordered just to be safe, especially if you have a history of high blood pressure or cholesterol. But here's the surprising truth. In seniors without any signs of heart problems, routine stress tests can do more harm than good. A cardiac stress test involves walking on a treadmill or receiving medication that simulates exercise while your heart is monitored for signs of restricted blood flow. It's meant to detect blockages in the coronary arteries. But for older adults with no chest pain, shortness of breath, or other symptoms, this test often picks up false positives, which can lead to unnecessary heart catheterizations, stent placements, and even bypass surgeries. And here's the worst part. Multiple studies, including research published in the New England Journal of Medicine, show that placing stents in patients who have no symptoms does not improve survival or prevent future heart attacks. It only exposes them to the risks of surgery, hospital stays, infections, and long recovery times, all for procedures that may not have been needed in the first place. Why does this happen? Because the heart is complex. Minor blockages can show up on stress tests even if they're not causing any real danger. But once something abnormal is detected, the cascade of follow-up procedures begins. And in many seniors, this leads to overtreatment. Instead of undergoing a stress test, just to be sure, seniors should focus on managing risk factors with lifestyle changes, medications when appropriate, and regular check-ins with a cardiologist. If you feel completely fine, no tightness in the chest, no shortness of breath while walking, then you may not need this test at all. Before agreeing to a stress test, ask your doctor. What will this test tell us that we don't already know? What are the risks if it leads to follow-up procedures? When it comes to heart health, treatment should be driven by symptoms, not just numbers on a screen. Test number 6. Overuse of thyroid function tests. The next test on our list is one that seems harmless, even routine, but can easily lead to lifelong medication for a condition you may not even have, the thyroid function test. Specifically, we're talking about the TSH, thyroid stimulating hormone, test, which is frequently done in older adults during general health checkups. As we age, it's completely normal for TSH levels to rise slightly. This doesn't necessarily mean your thyroid is failing. Yet many doctors interpret a mildly elevated TSH as hypothyroidism, an underactive thyroid, and immediately prescribe medication like levothyroxine, which is often taken for life. But here's what most seniors don't realize. A mildly elevated TSH in someone over 60 is not always dangerous. In fact, according to the American Thyroid Association, many older adults with slightly higher TSH levels have no symptoms at all, and their bodies are functioning just fine. Treating these borderline results can actually lower thyroid hormone levels too much, causing symptoms like irregular heartbeat, muscle loss, bone thinning, and anxiety. What's even more alarming is how many seniors are placed on thyroid medication without a clear discussion of alternatives. And once you're on the medication, doctors are reluctant to stop it, even if it was never truly necessary. You end up with lifelong pills, regular blood tests, and a sense that something is wrong with your body, when in reality, it may have just been adjusting naturally to aging. If your doctor suggests a thyroid test, it's not something to automatically reject. But if the results come back slightly off, especially if you feel completely fine, it's crucial to ask, do I actually have symptoms of low thyroid? Could these levels be normal for someone my age? Can we monitor instead of treating right away? In many cases, simple observation, checking the levels again in 6 to 12 months, is the safest approach. Don't rush into lifelong treatment for a condition that might not exist. How seniors can advocate for smart testing. Navigating the world of medical testing as a senior can be confusing and overwhelming. Tests are often recommended with good intentions, but that doesn't mean they're always necessary or safe. As you've seen, many common screenings can lead to overdiagnosis, unnecessary treatments, and even serious health risks when done without clear symptoms or medical justification. So what can you do? First, embrace the mindset of informed questioning. Don't be afraid to ask your doctor. What will this test help us decide? What happens if I don't take this test? How will the results change my treatment plan? These questions can help you understand whether a test is truly worth it. Second, remember that age-specific guidelines exist for a reason. Tests that were appropriate in your 40s or 50s may no longer be helpful, and might even be harmful, in your 70s or 80s. Lastly, consider seeking a second opinion before undergoing any test that feels uncertain or uncomfortable. A different perspective can provide clarity and peace of mind. Being proactive doesn't mean saying yes to every scan or blood draw. It means saying yes only when it truly protects your health. In summary, not all tests are bad, but the wrong tests at the wrong time can do more harm than good, especially after 60. You have the right to question, to pause, and to make informed choices about your health. If this video helped open your eyes to the hidden risks of routine testing, please like this video, subscribe to the channel, and share it with a senior in your life who deserves to know the truth. Your support helps us reach more people and protect more lives.